I'm here to help. It does change it, and doing this role has been more satisfactory than any job I've done before, and I probably will after, if I do say so. Hi there, my name's David June. I'm a care officer in the Bonneton area.
My name's Jackie Zeislick and I am a carer with the Care at Home Services for East Ayrshire Council.
I became a community care officer due to the pandemic. At the time I was working in retail, and I could see a lot of the elderly customers that come in were struggling due to the change of the world at that time, and I thought maybe I can take what I want to do into an environment where I can actually make a difference and make people's lives a bit more easier. And thanks to East Ayrshire Council, I've managed to find a job where I can do that with utmost care and with the great training they do provide.
I decided to become a carer as I've always enjoyed working with adults with problems with independence and who needed and required support. I started off in a care home, and after I had my children I joined East Ayrshire as they offered the flexibility I needed.
A typical day as a community care officer usually starts about 3 p.m, and that usually entitles your first few visits are always going to be your tea time. So you're a wee bit hectic because you've got to go in, make sure what they're having for dinner that day, if they've had their medication, and obviously have a look at your notes from how they were that before you were in. So I do the back shifts, so again you always check your notes when you come in just to see how your client was in the morning, and if they were a wee bit different, you just ask them how they were that day, general little bit of chit chat, make sure they've had their dinner, wee cup of tea, cup of coffee, and then you're on to your next one. And around about 6 p.m, that's when we start our bed visits, when you're maybe going back to the same person at tea time, doing their dishes, having a wee chat, making a wee bit of supper, and if they've got medication, assisting them into their nightwear if that's on the plan, if not, also helping them with their toileting. The best part of my role is seeing the progression of clients. Sometimes when you get a new client onto your run, you're trying to figure out obviously what their conditions are, what you can actually do to help them stay independent in their home, and seeing the progression from when you might have first had them, then they might be a month down the line, seeing them do things for themselves when they first got on the care that they couldn't do. And our jobs as carers is always to implement that they are independent and they're able to stay in their own homes. And nothing makes me feel better in my job is when a client is able to do a simple thing as make a cup of tea for themselves.
Making a difference, seeing how what we do helps.
You first go into a client, you go in there as a carer, but after you've been going in a couple of months, you come out as a friend. The training you require is moving and handling and your medication training, and you'll get induction training as well when you take on the role. After that, there are a lot of different courses the council offer. I've recently just completed a dementia course, which was really good because I do have some clients that have got dementia, and seeing how they're going down their journey with the condition, with the training I was provided with by the council, has really helped me understand dementia as a whole, but the training is fantastic. There's a lot of online courses as well that council provide. Really do help provide you with all the training you need before you go out onto the runs.
There's many different ways you can go when you're a care at home worker. You could become a care coordinator and eventually go through the ranks and become an area lead, an area manager. There's lots of opportunities if that is the career path that you're looking to take.
There's a mixed bag of different opportunities you can have from starting as a community care officer. You can go along the lines of becoming community alarms. It's where you'll be on call and it'll be someone, you've probably seen buzzers and lanyards and things that some of the clients may have. You are the response team for them. You've also got home from hospital is one I'm interested in myself, because you are the first people they meet when they're coming from hospital. You're assessing the clients to make sure what if they can come out into the community care, or if they're going to go into like different, for example, double runs, single handling runs. The council are really good at letting you know when there's new jobs available.
At the moment I'm happy with my job and what I do. I don't have any plans to move, but in the future I could maybe see myself becoming a coordinator within East Ayrshire Council, and eventually moving on from there to area lead, area manager.
In my career, I'd like to spend a few more years as a community care officer, learning the role as best I can before I see about progression. Ideally, I would like to do this role for foreseeable in my life, but I do know at some point I will see about moving on to different things. If you feel you can make one person's day brighter, you should look into being in care. Because even if you're on these people for 10-15 minutes, that 10-15 minutes could change their day.